supposed to do the appointments first, but
Time having arrived, I call this meeting of the Brockton's City Council Finance Committee to order. Madam Clerk.
Thank you. Good evening. Agenda 1, appointment of City of Brockton School Police Officer Alicia Fernandez of 56 Ford Street, Brockton, Mass. 02301 as Special Police Officer. Invited Alicia Fernandez.
Good evening, officer. Do you have anything you'd like to say to the councilors? All right, councilors, any questions?
Motion to recommend favorably.
Second.
Motion's been properly made and seconded. All in favor? All opposed? The motion is approved. Thank you.
Agenda item number 2, appointment of Rita Spinola of 27 Vermont Avenue, Brockton, Mass. 02302 to the Women's Commission for a 3-year term ending June 2025. Invited Rita Spinola.
Good evening. How are you?
I'm well, thank you.
Good. Do you have anything? You can take the mask off if you like. Do you have anything you'd like to say to the councilors?
I would just like to say, if I am giving the appointment or the opportunity, I would be very grateful. It's something that I am looking forward to and thought about diligently before even applying, so thank you.
Motion to recommend favorably back to the full city council.
Second.
Councilors, motion's been properly made and seconded. All in favor? All opposed? Motion passes.
Thank you.
Thank you.
Item number 3, appointment of Scott D. Almond of 142 Cashman Road, Brockton, Mass. 02301 as an alternate member of the License Commission for a 3-year term ending June 2025. Invited Scott D. Almond.
Good evening.
Thank you. I just want to say it's an honor to be asked to be on the License Commission. It's right in my wheelhouse, and I think I'd be a good fit.
Motion to recommend favorably back to the full city council.
Second.
Motion's been properly made and seconded. All in favor? All opposed? The motion passes.
Thank you.
Agenda item 4, reappointment of Sonia Dixon of 55 City Hall Plaza, Brockton, Mass. 02301 to the Women's Commission for 3-year term ending June 2025. Invited Sonia Dixon.
Good evening.
Good evening, everyone. It gives me great pleasure. It's apartment 507. I just received it Friday, and it was mailed out June the 8th. I have to say that I am very proud and I'm very honored to be standing here amongst the councilors here in Brockton, Massachusetts. And this is just a quick overview of who I am. I, Sonia Dixon, has a master's degree from Simmons School of Social Work in Boston, Massachusetts. I graduated in 2007. In 2008 was the crack epidemic ruining many families due to active drug use, rape, domestic violence, drugs dependency, prostitution, homelessness, child care, murderers, Department of Family Service involvement, mental health, and having an intellectual disability. As I watched the communities in the Boston areas and other city environments deteriorated, I wanted to make a change, and I was determined to do so. In the latter years, I became a clinician at Women's Incorporated, which is a therapeutic community residential program for women and reunification of family. I worked in Shattuck Hospital as a clinician overseeing the men residential program who were incarcerated. I work as an assistant program director for Welfare to Work program and Child Care Services. When I started this position, I had to hire a community worker to tutor the women in college course in child development in order for them to become successful and certified to be child care teachers. I supervise staff in the daily overall function of the St. Mary's Pregnant Teen Program. The nurse that oversees the program strongly recommended that I become a social worker. The nurse that oversees the program strongly recommend that I become a social worker. Due to the empathy that I showed towards the teens, I worked as a coordinator for the Boston Public Schools in developing individual educational plans for children who have special academic and emotional needs. I am excited and honored to have a chance about joining the Commission of Women's Issues. I have been working full-time with 25-plus years hands-on experience in a combination of education, training, and management, social services, community involvement, cultural diversity, and organization involvement in Boston, Mass. I am looking forward to do the same for the city of Brockton. Thank you.
Thank you. Counselors?
Motion to recommend favorably back to the full city council.
Second.
Motion's been properly made and seconded. All in favor? All opposed? The motion passes. Thank
Thanks, Ms. Dixon.
Thank you.
Agenda item number 5, ordered that the city council authorizes the acceptance and expenditure of the total grant funds in the amount of $250,000 from the Commonwealth of Massachusetts Community Compact Municipal Fiber Grant Program, FY22, Executive Office of Administration and Finance Grant Program, $250,000. To the City of Brockton Information Technology Department, FY22, Executive Office for Administration and Finance Grant Program Fund, $250,000. These grant funds will allow for the replacement and upgrade of fiber that connects the 2 main data centers used for police, fire, city hall, and emergency management services for communication and dispatch. Invited Ted Medeiros, Acting Director of Information Technology, Troy Clarkson, CFO.
Good evening, Mr. Director.
Good evening, Mr. Chairman, councilors.
Good evening.
Anything you want to start with? Or?
I almost wanted to stand up and go, because we applied for the grant and we were awarded it. So I'm open to any questions, anything people want to ask. I really don't, I want to stay away from physical, actual locations and things of that nature. We want to try to protect that and the security of it. I welcome a conversation offline with anyone who wants to get into that nitty gritty. I think the Madam Clerk really covered the overall purpose. I know a lot of people understand that we already have some fiber optics in the city, and we do. A lot of it is older, needs to be replaced. When you buy into this type of technology, they don't really talk about car accidents, they don't talk about trees. Things like that damage your cabling, and it doesn't last forever. And so that's what some of this will cover. But like I said, I welcome any questions. Otherwise, anything people want to ask, I'm open.
Counselors? Counselor Azak.
Thank you, Mr. Chairman. Good evening, Mr. Director. Congratulations on getting the grant.
Thank you.
Couple of questions. Is this a no match?
No, we have a match.
There is a match. What is the match?
10%?
10%?
Check.
So 10%, which is about, oh,
Say that.
do you want to give me a number, or?
Of the 250, right.
Okay. And the other question I have is, we've already spent a lot, we've gotten fiber here in City Hall. How are we not duplicating, what?
So this upgrade, well, like I said, it's to repair and replace some infrastructure that's been there almost 20 years now. The normal expected life is about 20 years. So we're really there, even with just what we have now. The real problem for us, like I said, is all the car accidents, the damage, the trees. Every time you do construction, you take it off the poles, you move it. That's really what this comes to. It's not a forever purchase.
Okay.
You will have to fix it, and you will have to add stuff as time goes by.
Definitely. So maybe I'm confusing things. I know through BCA a few years back, we got funding for also to do some work at City Hall. So is obviously, were you working together, do you know?
I'd have to look at exactly what you're talking about. I don't really remember that. I know years ago when we upgraded the City Hall Plaza, and it went to a park, there was a contractor that damaged a lot of the fiber outside, and we did have to repair that. But in relation to City Hall, we work a lot with BCA, with, you know, as far as trying to get things on television and get the proper equipment. Some of it is funded from the mayor's revolving cable fund. Not a lot of that would come out of like our department specifically. But I'd have to look at maybe what you're actually talking about specifically, maybe offline or
I
something.
can
'cause
go
I'm not
back in my
familiar with
notes
that.
as well. But thank you,
Yeah.
thank you very much. Congratulations on getting the funding. Thank you, Mr. Chairman.
Thank you, Counselor. Counselors?
Motion to recommend favorably back to the full city council.
Second.
Motion's been properly made and seconded. All in favor? All opposed? The motion passes.
Thank you, Mr. Chairman.
Director.
If I could, can I just say one quick shout out to the finance department. Paul, Troy, Tiffany, the whole staff really fabulous, but Paul really helped me with actually writing and crafting it. I mean, I'm a technical guy, right? So I do computer speak, and Paul and the others really helped with making that, I want to say, made palatable for everyone else who needed to read it and actually have to approve it. So I just want to thank them as well. So, thank you.
Thank you.
Thank you.
Everyone for your time.
Next agenda item, number 6, ordered that the city council authorizes the acceptance and expenditure of the total grant funds in the amount of $50,000 from 2022 Blue Cross and Blue Shield DCBS of Massachusetts National Fitness Campaign, FY22 National Fitness Campaign. 2, Parks and Recreation Department, FY22 National Fitness Campaign Grant Fund. These grant funds will be used by the Parks and Recreation Department to renovate Tukes Playground into a fitness court to meet the differing needs of the shifting community. Invited Tim Carpenter, Superintendent of Parks, Troy Clarkson, CFO, Tiff Casulo, Budget Director.
Mr. Chairman,
Counselor Farwell.
Mr. Chairman, I've been asked to, pardon me, move to table this. I understand there are some technical adjustments that have to be made with this grant, and so it's appropriate to have it come back at the next FinCom meeting. So I would move to table this.
Second.
Motion's been properly
I'm
made.
sorry, my error. I would move to postpone this until the next FinCom. My apologies.
They've requested it be tabled.
They've requested
They
it
have,
be
yeah,
tabled. We
so-
will table it.
Counselors, the grant comes from a nonprofit organization in California, which has different donation laws, different, sort of rules about how it can and, through how you donate. So this was not something that we could reconcile properly with our Massachusetts procurement law in accepting the donation. So this has to be tabled, and the mayor's office and the CFO have said they're going to try and rework it. In the meantime, other funding will be diverted to Tukes Park to make sure it gets the upgrades that are necessary. And we're gonna, see that in front of us, I'm sure, whenever that motion is made. So the motion to table is properly made and seconded. All those in favor of tabling? All those opposed? My item is tabled.
Item agenda number 7, ordered that the city council hereby declare the city-owned parcels located at Pelletronelli Way and Franklin Street, having parcel identifications of parcel ID 109-074 Lot B and parcel ID 109-075 Lot E, as surplus, and that the mayor of Brockton is hereby authorized to transfer the same to the Brockton Redevelopment Authority and therefore of the downtown Brockton Urban Development Plan as approved by the Brockton City Council on July 25th, 2016, in order to accomplish the modifications to the new road, Marvelous Marvin Hager Way, in the planned Pocket Park. Invited Robert Jenkins, Executive Director, BRA, Rob May, Director of Planning Economic Development, Megan Bridges, City Solicitor.
One more time, Executive Director. Director Emeritus.
Mr. Chairman?
Yes,
Just,
Counselor.
I would, good evening, Mr. Jenkins. I believe there's a Scribner's error that should read, after parcel 109-74, it should be Lot C, not B.
Yeah.
It should be Lot B. Good evening, counselors, and let me stand corrected. I am officially no longer the director of the Brockton Redevelopment Authority. It's my honor to introduce the interim executive director, Dr. Patricia Jackson.
Good evening.
Welcome.
Okay, welcome,
Evening, welcome.
congratulations.
Yeah. Congratulations. Congratulations.
So I guess I'm here to answer any questions in regard to the transfer of that property. I think I've spoken, I know I spoke to Councilor Thompson, just in regards to this. This is, to make this surplus makes it a better development for what I'm calling Lot A, parcel defined. Lot B is owned by the city, as well as Lot E that's across. We've made some adjustments to the marvelous Marvin Hagler Way to reduce its size in order to make Lot A more developable. So, and also, just so that there's some clarity, I know the map that you have don't show Lot E, but I guarantee it's there. But it's there so that the road that's supposed to start at Petronelli Way goes all the way across to Court Street. The city hasn't applied for those funds yet to extend it, but I anticipate that they will. The road, the plan has been always for the road to go to Petronelli Way, all the way to Court Street.
All right, councilors, any questions for the current or past director? Councilor Azak, followed by Councilor Farwell and Councilor Nicastro.
Thank you. So just, I happened to be at the parking authority this afternoon, and they're the ones that suggested that there was an error in the lot. So it is it Lot B or is it Lot C?
It is Lot B and Lot E, excuse me.
Okay, because they said that it's supposed to be, read Lot C on their map.
I think what they're looking at, because they do own, well, the redevelopment authority and the parking authority owns Lot C. It's A, B, city owns, and C, that was a surplus given to the redevelopment authority that the parking authority still manages. So they may be a little confused. They do still manage that lot, but that's where the pocket park is going to go eventually.
Well, thank you, and thank you for your time on the BRA, and best wishes in the future, and congratulations.
Thank you.
And welcome. Thank you, Mr. Chairman.
Thank you, Councilor. Councilor Farwell.
Well, very briefly, I'm going to miss you, Robert. Oftentimes, I thought you were the voice of reason in the wilderness. And,
Sometimes.
and those are good to have in government, to have that voice of reason. This is all part and parcel of what's going on downtown.
Correct.
Which I know Councilor Thompson's excited about, and the rest of us are. I just wanted to ask your successor, your interim director, I take it you've looked at this, you're comfortable with it. I just want to make sure this has
Yes,
your...
I've been working with Robert, listening in with him, and Rob may have been planning and working with him on it, so yes, I am.
Okay, well, that's all I have, Mr. Chairman. Thank you very much.
Thank you, Councilor. Councilor Nicastro.
Thank you. Good evening.
Good evening.
You just couldn't get enough of us.
I couldn't.
So where is parcel E? Because, or Lot E? Because it's odd to be, given an order listing two things and a plan, but yet.
Unfortunately, on that, when we sent that map out, Counselor, we were really focused on Lot B, because that's where the real development, and we have a land disposition agreement with a potential developer. So that was really the focus, but then it came to that because we're reducing the size of the road, and it's always was planned to go from Petronelli to Court Street, we should include Lot E, which unfortunately, our fault, we didn't include that full map.
Do you have a plan that shows Lot E?
Yes.
Yes, I can get it out to everyone.
Send it along to us, would you, before we have to vote next week?
Yes, ma'am.
That would be very good.
Yes, ma'am.
Thank you. And my best wishes to you.
Thank you. I'll still be around. You have my number.
Okay.
Done it now.
Thank you, Mr. President.
Thank you, Councilor. Councilor Thompson?
Yes, thank you, Mr. Chairman, and good evening, Mr. Jenkins and Ms. Jackson. I just want to echo this council's gratitude and for your service to our city over, how long was it? 13 years as director of the BRA, and really excited for your future over at Mass Development. And, we'll be calling on you in that position as well, I'm sure. So just for the council's information, about 2 years ago, this council approved a subdivision for the lots in question. These were all city parking lots. They were open-air lots in this location, and it was decided that to further help develop this downtown Brockton, that we would subdivide these certain lots to make them more developable. And that's exactly what's happening. A developer is in the process of developing Lot A. During those discussions, it was found that due to the position of Marvin Hagler Drive and, you know, its location, its size, that the development that could be built on Lot A, what is now the new Lot A, really would not be a good size development. It would have to go higher, which is more expensive. It would have really very little green space. It would have little to no turnaround space because there's an easement on the other side of the lot, which abuts 28 Petronelli Way. There's an easement that both lots share. And so because of the square footage of the existing lot, a development could be built there, but it just wouldn't be an optimal development. So working with the developer, working with Rob May in the planning department and Mr. Jenkins over at the BRA, we petitioned the state to see if we could reduce the scope of Marvelous Marvin Hagler Way and also move it a little bit more east. And so the state approved that. And then, so we went ahead to draw up new plans to shrink the scope of Marvelous Marvin Hagler Drive and to move it east a little bit. Two things: that increases the square footage of Lot A, giving the developer a better opportunity to really develop a residential development on that lot that we can all really be proud of. And then secondly, it does allow for us to develop that pocket park to the east where the Marvelous Marvin Hagler statue will be. And so this is just an example of this city council, the BRA, the planning department, and the developer really working together to optimize our land downtown and build the best development possible. And so we've done that. I'm really proud to be part of that team, and I recommend that, you know, I'm asking for your favorable vote on this issue. Again, thank you, Mr. Jenkins. Thank you for your service. And Ms. Jackson, we're looking forward to working with you in the future.
Thank you so much.
Thank you, Mr. Chair.
Thank you, Counselor. Anybody else? Councilor Minichiello.
Hello, Mr. Jenkins.
Hello, Council.
I would just like to wish you well, and also, we've been together since, what, the 90s, the Brockton Community Corporation? You were the executive director.
You were on that board too, Councilor.
I was on that board, exactly. When I was a fresh little lawyer out of law school in the early 90s, 1990. So it's a few years back, but I can just say this about you, Mr. Jenkins. From the day I met you, intelligent, honest, ethical, hardworking, always wanting to help people that needed help, always wanted to provide better housing for people in the city, always never shy to do hard work, roll up your sleeves, get a better project going, unique ways of looking at things, just a dynamic person, a good person, someone that I've come to know, admire, and enjoy knowing and working with, and saying that, you know, Robert Jenkins is a friend, you know, so.
I appreciate that.
Wish you nothing but the best.
Thank you. Thank you.
And our loss is their gain, but you're not too far away.
Not too far.
He already has a big head, so let's just keep it.
Well, you know, in some respects, he deserves to have a bit of a hard head, but just know what I think of you, which is very highly think of you.
I appreciate that, Council. Thank you so much.
I hope you listed us as references. Thank you, Counselor. Counselor D'Agostino.
Quickly, I again just want to thank you for your service. We recently had a chance to sit down and meet, and we had a great conversation. I really learned a lot, and I really appreciate that. And you know, it's our loss, but and there again, as Councilor Minichiello said, and congratulations to you. You'll certainly be missed, at least by me. Thank you.
I appreciate it. Thank you.
Mr. Chairman, I make a motion to recommend this
Second.
favorably to the full city council.
Motion has been properly made and seconded. All in favor? All opposed?
Thank
This is
you.
approved.
Thank you.
Thank you.
Thank you.
Thank you, Madam Director. Madam Clerk.
Agenda number 8, be it resolved that members of the Brockton School Committee, Superintendent of Schools Michael Thomas, Mayor of Brockton Robert Sullivan, Chief Financial Officer Troy Clarkson, Chief Financial Officer for the School Department Aldo Petronio, or their designees be invited to come before the Finance Committee to discuss athletic facilities in the community, funding, and the need for development of fields and upgrades for recreational uses in the city. Invited, Mayor Robert Sullivan, Michael Thomas, Superintendent of Schools, Troy Clarkson, Chief Financial Officer, City of Brockton, Aldo Petronio, Chief Financial Officer, Brockton School Department, Joyce Asak, Vice Chair, Brockton School Committee, Tony Rodriguez, Brockton School Committee Member, and Tim Carpenter, Superintendent of Parks.
Counselor Thompson.
Thank you, Mr. Chair. Mr. Chairman, I received a request from the mayor to postpone this matter. He would be unable to make it tonight, as is Mr. Clarkson and Mr. Carpenter. And so in an effort to really have full participation on this extremely important matter of addressing our athletic fields in the city of Brockton, I'm going to ask that I make a motion to postpone this matter to the September 6th, which would be the first Tuesday because of Labor Day on that Monday, but our first Finance Committee meeting in September. And so I make that motion.
On the motion, September, on the motion, September
Counselor
6th is,
Azak on the motion.
September 6th is an election night.
Oh, is
Are we holding a meeting?
Why do I think you're not going to be there, Counselor?
Well,
No, I have yet to talk to the clerk, but I don't see any reason why we would have to, especially with, 2 counselors who would be otherwise occupied. Additionally, it is a Tuesday. The school committee members may not be able to attend.
So then, if I could amend my motion to make it whatever you're right about the Tuesday with the
just
school
popped in my
committee.
head.
No, you're absolutely correct.
Next available meeting.
Then,
Next available FinCom meeting in September.
the next available FinCom meeting is September.
So moved. All right.
Second.
Second. Motion's been properly made and seconded. All in favor? All opposed? Motion's approved.
20.
Item 9, be it resolved that a designee of Neighborhood Health Center be invited to come before the Finance Committee to discuss mental health services offered and upcoming mental health initiatives. Invited, Sue Joss, CEO of the Brockton Neighborhood Health Center, or designee.
Madam Director, Madam Designee. How are you?
Thank you for having us, Counselor, and thank you for Counselor D'Agostino for personally inviting us to be here and to discuss such an important issue. I call it our other pandemic, that the need in Brockton and the Massachusetts and the whole country is just so intense in behavioral health services. Do I need to do anything to make this come on your screen, or?
Mr. Clerk, is that good to go?
Oh, there it
I
is.
think cable should have it. All right, it's good. You're up. Yep,
Thank you.
take it away.
So first, I'd like to introduce Dr. Maria Celli, our Deputy CEO, and Maria is also a licensed psychologist, so wanted to have her here for this discussion. We're not here to ask you for anything. We're just here to give you an update on what we see going on around us as far as mental health, behavioral health needs in the community. So I will start. I'll give you an overview of where we see the needs and what the state has started to do about it. And then Maria will get much more local with you and give you a lot more information about what's happening in Brockton and how we see the future progressing in a fairly near future on behavioral health needs. So just a quick overview of the health center before we get started. These are our 4 sites. Our main site, which most of you are familiar with, right on Main Street, The site on the top right that you see is our site at Vicente's, attached to Vicente's Market. That is our pediatrics department and also our teaching kitchen where we do nutrition classes. On the bottom left, we have a very tiny clinic, 1 exam room at Mainspring. The trailer that you see, we'll talk to you about in a few minutes, that is our substance use disorder treatment trailer that roams around the city where needed. An overview of our services other than behavioral health, we have primary medical care for all ages. That's doctor's office visits, basically, sick visits, chronic conditions. We have a very large OB/GYN practice where we are doing more than 500 deliveries per year at Brockton Hospital. So that has gotten very large. We have dental, eyes. We provide a lot of health education. We have a Ryan White funded HIV program. 3 registered dietitians providing nutritional education to our patients. And then we refer out to specialists. And I added vaccinations on, even though it's part of primary care, because it seems like lately it's been a lot of vaccinations with the pandemic. And then this is just a very quick rundown of our behavioral health services. Maria will go into a lot more detail in a minute. But we do comprehensive psychosocial assessments, psychiatric evaluation, crisis evaluation, individual therapy. We are happy that our groups are about to return. Those had to shut down during COVID because of not being able to be in person with people. And then substance use disorder services, including Suboxone and Vivitrol treatment. This just gives you an idea of our service area. The big green section is Brockton, so about 2/3 of our patients live in Brockton. This is our payer mix. The item I would point out is that most of our patients are either uninsured or public payers. The 25% in the upper right in red, upper left in red, sorry, are uninsured patients. This is the diversity of the patients we serve. So our patients are very, very diverse. We have lots of languages. More than half of our patients use interpreters when they come to the health center. The big green section at the bottom is patients of Cape Verdean background, and over to the right, the more reddish, 17% is patients of Haitian origin, so very diverse. And this has been our volume. We have about 37,000 patients. That does not include patients that we saw just for COVID during the pandemic. This is our ongoing patients. You see a very large growth curve, which dropped precipitously in the yellow bar. We don't count COVID vaccination and testing as visits. So you see our visits without those really drop precipitously, and we're now in the fiscal year that just ended, a little bit of rebound, but still a ways to go. So what we're seeing since the pandemic started, and I would preface this with, we already had a huge need for behavioral health services before the pandemic hit. So the pandemic has only made things worse for all of us. But steep increases in anxiety, depression, loneliness and isolation as people lost their social connections, and increased reports of suicidal and self-harming thoughts, both in adults and youth. In 2021, the State of Mental Health in America report confirmed all that we already knew, and also noted that most states in the country are not prepared to deal with the crisis that's facing us on behavioral health services. We think about 20% of people before the pandemic were experiencing mental illness of some form. We can only guess that that has increased over the pandemic. And in 2021, 4.5% of people reported serious suicidal thoughts. And that's an increase of 664,000 from the prior year. So this is our data from Brockton Neighborhood Health Center, and you can look at the detail in your leisure, but we provided more than 59,000 behavioral health visits in 2021. So huge, huge need. We're not even coming close to meeting the need even for our own patients. And we wanted to give you a little bit deeper dive for children. This, for those of you who are familiar with the presentation we made in February to the school committee, the next couple slides are the same slides. But there was a survey done right before or early in the pandemic of Brockton Public Schools guidance and adjustment counselors for grades 6 through 12. And they said that only 200 of the 8,400 secondary students were connected to mental health service providers that year. That 39% of the counselors were aware of children who had cut, burned, bruised themselves on purpose in the past year, and that 36% were aware of a child that had contemplated suicide in the past year. They're really pretty scary numbers. Nationally, I'm going to give you some information now from a group called Team Up, which Maria will explain in a little bit more detail. 1 out of 5 children experience mental health issues. 8 to 10 year delay in properly diagnosing children on average. Lack of training of clinicians and shortages that I would say are so endemic that recovering from them is going to take a very long time, even with the changes, the exciting changes that Maria will be telling you about. And mental illness is the most costly childhood illness in the country. This chart, it's a little bit hard to follow, but it's scary if you understand it. Team Up did a survey of teenagers from 4 health centers, including ours. And what they found was that the suicidal ideation of that group, including our own teens, was 2.5 times the national average. And that was before the pandemic. So a lot going on there.
Can I add one thing about that slide so that I don't have to circle back to show you this slide? As you'll hear in a little bit, Team Up is a collaboration funded by 2 private funders where health centers across the state of Massachusetts, select health centers, were funded to create these teams of clinicians and primary care providers, so pediatricians and community health workers. I'll tell you a little bit more of the structure of that program. But so all of the teenagers who were surveyed are Team Up teenagers, okay? So teenagers who have been involved in the health centers, who have sought care in the health centers who were part of this cohort. So what I think matters is that it's students, it's teenagers, young people who are part of Brockton, who are represented in this survey, and then other communities like Brockton in the state of Massachusetts.
Thanks, Maria. And we want to make sure that we call out substance use disorder within the behavioral health crisis. This is opioid overdose deaths in Brockton over a several-year period. The last on the right there is 2021. And what you see, first of all, is an upward trend over the last 4 years in deaths. The green line is deaths to Brockton residents, and the blue line is deaths that actually occurred in Brockton but may or may not have been Brockton residents. Part of that, we have to wonder if that's because that's where the hospitals are, but still staggering numbers. Looking at, there were some focus groups done about why individuals choose not to go into treatment. Number 1 on their list is availability of treatment, even though treatment is available. So interesting conundrum there of trying to figure that out. And then second, those who are not ready for treatment. And what they need most, according to their survey, number 1 by quite a large amount was sober living options, followed by support groups. And wanted to just kind of share trends in the drug supply and why we think the deaths are going up so much. We're not really sure that people are necessarily using more, but what they're using is so much more lethal than what was on the streets a few years back. So fentanyl, xylazine, which is a horse tranquilizer, and we are not even at this point sure that Narcan works on it. the potency in the opioid products, and other types of pressed pills. So it may not necessarily be that there are more people using substances, but what's out there is just so much more severe. So now now that you're all probably depressed and overwhelmed as we were when we put these slides together, there are some things starting to happen. At the federal level, the 988 Suicide Hotline launched this past Saturday. So that's a good thing as far as just centralizing and giving people a really easy number to understand. We also heard horror stories from other states, not Massachusetts, about their suicide hotlines having a 10 to 20 to 30% response rate as far as people available to answer the phone when people needed them. So this national, we're pretty excited about this. I wanted to talk for just a couple of minutes about the state's vision. Some of you may know the Secretary of Health and Human Services, Mary Lou Sutters. And when she took her position in the Baker administration, her mission, and I think the primary reason she took the position, is that she wanted to do something about the behavioral health crisis in Massachusetts. And she had put together a work group. Maria and I were both invited to be on that and met with her and her team a number of times. And we're really starting to envision what a better behavioral health system in Massachusetts might look like. And then the pandemic hit. So everything stopped and was put on hold as she and her team and all of us dealt with the more immediate crisis in front of us. Not that behavioral health was less urgent, but this was just more immediate, and we only had so much staff, and so did they. So now it's come back, and all of the hard work we put into before the pandemic has now turned into what the state is calling the Behavioral Health Roadmap. And what the state envisions, and we wholeheartedly support, is a multi-year blueprint that really maps out, first of all, what the state is calling a front door to treatment, that basically talks about people should not have to wade their way through an incredibly onerous, burdensome system to get the help that they need when they're most in crisis and least able to manage emotionally that system, and then only to find out that there are not adequate resources to care for them anyway, in many cases. So really long overdue, just a total revamping with a vision of making behavioral health services equitable and on a par with medical services. If we put you through, for medical services, what people are put through for behavioral health services, we would all be a lot sicker, and probably some of us wouldn't be managing that system either. So looking really a vision of a kinder, better system for everyone. So the front door, the idea of that is to connect people with a provider before they're in crisis. Routine help for urgent needs. People may need to be seen same day, but they may not be on the verge of needing to be admitted to an inpatient psychiatric facility if we can catch them at that earlier stage. So really a comprehensive range of services that we hope people will be able to access early on when they need it. Expanded access to treatment. I mean, part of the problem is there just aren't enough clinicians out there, and there's just so many reasons for that. Some of it's financial. It's hard to get people to go into behavioral health work as either a social worker or a mental health clinician when a master's degree gets you a salary that you might earn with a high school education. So major changes needing to happen in that whole workforce pipeline. And just more availability of services and more organization and coordination of services. So that's where one of the main projects the state is working on right now is community behavioral health centers. And those will begin in January. They have just been awarded statewide, including in the Brockton area. And those will allow same-day evaluation and access to treatment, evening and weekend hours for care, urgent care, which is same day, and evidence-based treatment for anyone who needs it, 24/7 locations for crisis, and including crisis stabilization beds. So that's the vision. And taking it over to,
Yep, pass. We could just switch seats.
yeah, which is.
We don't want to interrupt IT. Then we'll really be in trouble.
Thank you.
All right, I think the next few slides are actually going to be zeroing in. So Sue gave an intervention on the national level, interventions on the state level, and then I'm going to be speaking a little bit about interventions on the local level, partners that we often work with. We'll look into what does Brockton Neighborhood Health Center currently offer, and then giving you an update on things that are coming down the pipeline from Brockton Neighborhood Health Center and from some of our wonderful community partners who are currently, active in Brockton. So what you see here is a list of, an ever-growing list, actually, of participants who have joined a bit of a grassroots efforts that we're calling the Brockton BH Task Force. Name could still change, but what happened was during the pandemic, we were hearing from the local hospitals about how the EDs were actually on their knees. They could not manage not only the COVID need, the medical need, but also the behavioral health need. And we were hearing about, we were hearing about sometimes that behavioral health need was very clinical. It was somebody who needed a higher level of care, needed to be medically cleared and seen for a psychotic episode or, something that was definitely medical. And in some cases, it was something much more sub-threshold, something that could have been managed in another way. So we put together, just a number of us got around the Zoom table and we started to meet on a monthly basis to talk through how were we going to try to address this issue? How could we support our hospitals? How could we support each other? And most importantly, how could we support the members of, the residents of Brockton and surrounding communities to not need to go to the emergency room? We actually got, I believe Sue may have even called Secretary Sutters, but we got a member of EOHHS to join the task force for a couple of sessions. But then the community behavioral health center RFP went out and they said we need to excuse ourselves, otherwise it might be a conflict of interest. But we had a presentation so we could get some ideas and started to actually percolate on how can we start to take some of the roadmap ideas and bring them to life in Brockton. What you see here is the list of the BH task force, the list of Brockton, some of the Brockton area partners that BNHC works with the most, and that I think would be important for the counselors to be aware of. This is not a finite list. There are actually a lot of resources in Brockton, and we're so grateful for that. And then the members in red are the ones who are active members of the BH task force on a monthly basis. So zeroing in a little bit more on what BNHC currently offers, and actually has been for some time. So taking a page, actually the BH roadmap takes a bit of a page from this particular thread of what Brockton Neighborhood Health Center has always offered proudly, which is our integrated behavioral health services. At BNHC, we have integrated clinicians and community health workers who are co-located with all of our medical treatment providers. And the reason that community health centers have been doing this for years is because we know that our patients are, if we give them a number to a therapist, they're not going to call. It's much less likely. But if we introduce behavioral health services as a natural, expected part of primary care, individuals are much more open to it. Why? Stigma. Why? Ease. It's just that extra thing. People don't think that it's necessary until it becomes a pathology and a real emergency. So actually, integrated behavioral health was not born at BNHC, but we're very proud to say that we've had it alive for a long time. And it's still a current, very active program. We have integrated clinicians and community health workers in adult medicine, in all of our medical services, adult medicine, OBGYN, and pediatrics. Honestly, I'm trying to get a clinician in dental because a lot of people are scared to go to the dentist, but we haven't gotten there quite yet. We also offer outpatient services. That means that we have a team of clinicians, psychiatrists, psychiatric nurse practitioners, social workers, licensed mental health counselors, and a case manager, so clinicians and non-clinical supports to manage more ongoing therapy. So for those people who, 1 to 2 to 3 visits with the primary care provider and the integrated clinician are not enough, they can seek these outpatient services. And then we also offer care management support for higher risk patients, including an ED, an emergency room patient engagement specialist who is just extraordinarily good at connecting with some individuals who are highest need and most in the margins of the community. A few of the agencies that I wanted to highlight for everybody are BAMC, CCBC, and High Point. BAMC is an agency that you may know very well, but they offer a lot in the city of Brockton. In particular, I wanted to highlight a helpline. The phone number is not here, it's in a previous slide, but the helpline is a service that BAMC has offered for a long time, which many of the residents of Brockton have utilized before. However, in talking with BAMC, they've noted that the helpline has been a bit of a one-stop shop where a resident of Brockton could call and say, I need help with this, I need help with this, I need help with this, and they will help connect residents to services. What I've heard is that during COVID, the volume of phone calls has been so high, it's been really difficult for them to keep up. But we know that is a strategy that works when we can have a sufficient support and supply for the amount of demand and need that there is in the city. And I can say that, I've had patients who have called the helpline and been helped in the past. So, an N of 1, but lots of our providers do rely on that service. BAMC offers outpatient services, something called a community service agency contract with the state that provides a lot of services for kids, early intervention, and then the COPE Center with whom we collaborate often. It's important for, I think, the counselors to be aware that CCBC is an important agency in the city of Brockton and surrounding areas. They currently hold the contract with the state for emergency services, so crisis response. They're located at Brockton Hospital. And again, have been a reliable partner in the city when patients, residents have emergencies in their homes or emergencies and are on their way to the emergency room. It's beneficial to call CCBC, and that oftentimes can serve as an emergency room diversion. And then the community services program is another excellent program that CCBC offers that we rely on often. High Point Treatment Services and Affiliates is another agency who we've partnered with a lot, and I think a lot of our residents might know of. High Point offers behavioral health and substance use services for the residents of Brockton and surrounding communities. Highlights for the counselors today that I'd like to bring forth are that certainly we rely on are the detox opportunities for within Brockton and on their Plymouth campus. Crisis stabilization, which they offer also in Brockton and on their Plymouth campus, and then a behavioral health community partnership that we are a part of with High Point Treatment Center, as are some other agencies outside of the city of Brockton. And why is that important? It's because this particular program, while it's not huge, again, is one of these that offers connection, outreach, engagement, and linkage to services for those individuals who are possibly least likely to connect to services. What is coming down the pike? So things to look out for in Brockton. As Sue had mentioned, the state's behavioral health roadmap includes this front door to behavioral health services. It's called the Community Behavioral Health Centers. We have found out that the agency that has received the award for the city of Brockton is High Point Treatment Services, who I just mentioned. But they are working in collaboration with CCBC, who I also highlighted, and Child and Family Services, which is an agency that is stationed, I believe their primary office is in New Bedford. I could be wrong on that one, but they're also, but they have a lot of experience working with kids. What we can expect currently, according to both High Point and the state, is that these CBHCs, including the one in Brockton, should open January of 2023. They will offer outpatient therapy services and psychiatry for adults and children. The mobile crisis teams, which will be operated by the CCBC group. And that, most importantly, again, that it responds to the need that we identified, the task force identified during the pandemic very critically, which is this use of the emergency room for behavioral health purposes. Now we can have another place that can really serve as a diversion so that individuals can walk in and say, I'm in crisis, I need help right now. And this will go, at Brockton Neighborhood Health Center, like I said, our integrated clinicians have served as that, but it's for the patients who are also in primary care at Brockton Neighborhood. That's 37,000 patients strong, but that's not the whole city of Brockton. So this is, again, we're a partnership here. We are all here for the same purpose. The CBHC will also offer crisis stabilization, and so I was framing this as the slide of the who, when, where, what, and why. Well, the why is the need that we've clearly identified. This is the mock-up that I received from High Point Treatment Center's President and CEO, Daniel Mumbauer. This is just a very brief, clear, easy mock-up of their Brockton campus and where they expect to distribute the different pieces of the CBHC. So another thing that Brockton has been lacking, and honestly I'm really excited to say is coming down the pike, is an inpatient unit, particularly for young adults. So it has come to my attention that Boston Medical Center is going to be opening an inpatient unit in the fall of 2022. So again, who, when, where, what, and why. The need is clear, and you can see on this slide what they're going to be offering. And then refocusing on some special populations that Sue had mentioned. So I think we could all agree with this quote from by Frederick Douglass, that it is easier to build strong children than to repair broken men. I'd say broken adults. But I think this is partly why BNHC and other community health centers across the state have been working with Team Up, which is transforming and expanding access to mental health care in urban pediatrics. Why we've been working together so much to try to really augment services for early childhood mental health treatment. The purpose is to build capacity in community health centers to deliver high-quality, evidence-based, integrated behavioral health to children and families. The program is built on a foundation of transformation, so creating learning communities, strengthening primary care foundations, and transforming clinical care. Things that I just want to highlight really quickly about this, and this is for myself as a psychologist who has worked, trained in trauma and worked in early childhood mental health myself, is that, once again, why is Team Up so valuable? Because it is a program that has focused not only on treatment per se, but on elevating the whole pediatric workforce so that pediatricians are more likely to be able to spot a developing mental health disorder in a child, can know how to collaborate, feel equipped to collaborate well with a school system and get that child services in the school as well as in the medical office, right? But also it becomes an opportunity to where the patient becomes not just the child but the family system, so that we're working on genuinely prevention. We're trying to work upstream before that individual gets any older and and the pathologies crystallize. I mean, if you've ever seen neurologists speak about what happens in the first 3 to 5 years of a child's life, you're really developing the neural pathways for regulation, for learning, for so many things. That is a time where we can really impact a child's trajectory around learning the skills, the coping skills, to maximize their psychological health and well-being. So again, as you can see, I'm pretty passionate about this project and about pediatric mental health in general. And so it won't come as a surprise that Brockton Neighborhood Health Center was very excited to try to move towards the development and launching of a school-based health center here in the city of Brockton. So we were very excited to be collaborating with the public school to open this site at the Brockton High School. What you see here is our first iteration. Actually, it's probably like our fourth iteration of the mission statement for this site, which we came up with not independently, but ourselves, as well as a number of stakeholders from the Brockton Public Schools. And what we're hoping to offer there is medical and behavioral health services, as well, I think we're calling it Primary Care Plus. So it's a full-time primary care provider, behavioral health clinician, a community health worker, and an office coordinator who also, by the way, as you could see in that slide, there's still a number of kids who don't have, who aren't eligible for Mass Health or maybe haven't been registered for that. So this particular office coordinator can help patients, it can help students with that as well, students and families with that. This slide shows in that little yellow rectangle on the middle left, shows the location. It's an aerial view of the high school with a location of where the proposed school-based health center will sit. And that is a very simple mock-up of what the exterior of the building will look like. And then another special population that we wanted to highlight for all of you again was the services that we're offering for substance use, for individuals struggling with risky substance use or addictions. Within our what Brockton Neighborhood Health Center calls our harm reduction clinic, we offer a nurse care manager model for medication for opioid use disorder, Suboxone, Vivitrol, and Sublocade. Medication for alcohol use disorder, Vivitrol, Campril, Antabuse. Behavioral health counseling, recovery coaching, and contingency management for stimulant use disorder. So the point is, if you're in some treatment facilities, if you're struggling with opioid use disorder, you can get treatment, but if it's stimulant use disorder, you cannot. We really wanted to create a site where it didn't matter what substance you might be using. We want to help and offer treatment services. How we deliver these services: low threshold, so treat each use disorder as its own, flexibility for appointments and starting services are not mandated, et cetera. So again, it's really trying to create very easy low threshold access to these services. As a very stigmatized and often marginalized group within the substance use disorder population, we have zeroed in with some state-funded dollars on offering services to our pregnant, and postpartum, pregnant, postpartum, and parenting women with an existing substance use disorder or with a history of substance use disorder, opioid use disorder in particular. And again, the services that this particular program, which we call Moms Do Care Office, offers are on this slide. And then, as Sue had mentioned, just about a year ago, we launched our mobile services unit. And this unit was a collaborative effort with the Kraft Family Foundation, who funded the building of this unit, and then Healing Communities, which funded the vehicle that has to transport it, just to be frank. So you will see this unit running, rolling around town. We have specific hotspots where the mobile unit sits, and we have a multidisciplinary team of, as I said, behavioral health clinicians, NP, recovery coach, who offer medical services, addiction services, anything low threshold available to those individuals who may otherwise not make it to medical services. And then as far as substance use services and resources in the community, this slide just reflects in a little more detail what some of our partner agencies are offering in the community for treatment of addictions, because it is such a significant issue in the city of Brockton. Thank you for sitting through that. I know it was a lot, but this slide concludes our presentation of the slides.
It's a lot, but it's necessary. Thank you. Counselors, I'm going to open the floor. Counselor D'Agostino is the sponsor. Would you like to lead off?
Sure. Thank you, Mr. Chairman. Thank you so much for coming tonight and for the material that you presented and just the work that you guys and your staff and everybody does for our city and for the folks that live in our city and are in need. You know, so again, I just want to thank you for coming and for the information. I'm really happy to hear that, you know, in January that front door we've talked about is going to be opening and available. You know, certainly we've talked about how huge and important that's going to be. You know, and I love that all these agencies are collaborating and working together and, you know, really putting the people we all serve first. So again, I appreciate your time tonight. I know on a summer and you know, a Monday in the summer, there's probably lots of things you'd like to be doing, but although the weather's not that great outside tonight, so. But thank you again so much.
Thank you, Counselor. Counselor Farwell, followed by Counselor Nicastro.
Thank you very much. It's almost overwhelming to think what you do on a daily and a weekly basis. A couple of questions for the public, because I find this when I book a doctor's appointment myself. Obviously, the demand for services is very high. And if it's like a regular doctor's office, you might call in and want an appointment and you're told that, well, we're booking out 2.5 months. For a person who might have, and let's focus on children for a minute because I think they're very vulnerable. For someone who may need an appointment because of a significant issue occurring with a child, is there a significant delay in booking an appointment? I mean, where are you folks with the ability of handling the demand for services given the staff that you have?
In behavioral health in particular, or, yeah? Yeah. So, I mean, for Brockton Neighborhood Health Center, any of our patients can actually see a clinical social worker same day.
Okay.
Yeah. So that's what, those are our integrated clinicians. So what happens is we actually have a model where actually pediatrics has better staffing than adult right now, just because of this team up program, we've had a little bit more luck hiring for those clinicians. But yes, if we could have a child who walks in and says, you know, the parent says, I'm overwhelmed with my child, I need somebody who can talk to them. And we will have a social worker meet with that child that day.
But if it requires a follow-up, if it's serious, you know, I work for a company that transports children for another school district, and one of them happens to get in the vehicle and she starts biting herself and banging her head in, and I actually think the parents need treatment because they're so stressed out about it. But if you had a very significant case where there was an immediate need for follow-up with a clinician, would it be fairly soon, or?
At Brockton Neighborhood, yes,
Okay.
immediate, yes.
I would say where that gets more difficult is if it's so serious that it needs hospital admission, and the patient, at that point, we would have them transported right now to the emergency room, where they could wait for a psychiatric bed for days. And so that's a piece of the system that we're hoping the 24/7 crisis beds will help alleviate. And I think another piece of that is just that if there's more services available throughout the community and throughout the state, that maybe we don't get to that crisis level with quite as many of those children.
Okay, and the last question for me is, obviously, revenue is critically important, and nothing happens without sufficient revenue. I take it you're keeping your head above water with the revenue stream, because, you know, for the public, we don't provide anything to the Brockton Neighborhood Health Center. I hope people realize that it may say Brockton Neighborhood Health Center, the name Brockton, but it's not like a city hospital or a city facility. You are entirely on your own in terms of generating revenue. So things are looking okay? Things are looking rosier, or you're worried, or where are we?
They're actually rosier. Part of the roadmap that the state put out had lots of dollars attached. And at the same time, through the pandemic, there were some really good things happening for community health centers financially. So we're in better shape than we were before the pandemic. First several months of the pandemic, we weren't sure how we were staying open, but things have really turned around for us. So I would say the better rates that we're getting are a real important piece of the puzzle, as well as some things the state is doing around loan repayment. My worry is that everybody's rates go up. There's still only so many clinicians, and we'll be able to do a better job paying them what they deserve, but it doesn't necessarily increase the capacity of the system. So that's an issue that's going to take years of loan repayment programs and students realizing that you can make a good living in that, and for so many years you couldn't. So I would say workforce is our major challenge, not finances right now.
Well, thank you again very much, and thank you, Mr. Chairman.
Thank you, Counselor. Councilman Castro?
Thank you. Good evening. It was just a wonderful presentation and so much important information. And I get calls from residents about all sorts of matters. And I would love it if you would share your PowerPoint with us so that I have a place to begin on occasional calls that I receive.
We can leave the flash drive here for sure if somebody wants to.
That would be
spread it.
wonderful.
Yeah.
Thank you. I thoroughly enjoyed it. Thank you, Mr. President.
Thank you, Counselor. Counselor, if there's nobody else who has not spoken a first time, we'll go to second round. Counselor D'Agostino.
Thank you. So I just wanted to hear, or let the other counselors, get their questions in before I asked a few things. So I was recently out on a ride-along with one of our police officers, and had kind of asked him, about mental health issues and what they're seeing on the calls they're going on. And, obviously a lot of the calls that they go on, there is some mental health component to many of them. Can you talk a little bit about your relationship with the PD and how you work with them? And
Yeah, so we don't have a clinician who rides along with them. That model, I don't think that model is currently, at least BNHC is not currently supplying that. But,
okay.
But interestingly, we've discussed it with them in the past.
Okay.
So that would need a little bit of Kickstarter support, but I think we'd be open to it for sure.
Okay.
How do we collaborate? We collaborate with the Brockton Police Department very frequently. So
Okay.
for medical reasons, or, if we've got circumstances of individuals who need a higher level of care, oftentimes, every time emergency management will get involved. If we've got individuals who we're worried about, we try very hard not to elevate the level of care if it doesn't need to be. We will try to see them more frequently until that individual is stabilized. We leverage our community partners like CCBC, who have the emergency service program. But we engage the the police if it's necessary. There's still a lot of room for creative, collaborative improvement in services that are both rendered to the community and also to the emergency services providers themselves. So the police, the fire department. That's,
Okay. And I apologize if I caught you off guard. I didn't mean to.
no,
It's fine.
Right. And then earlier you talked about the new federal 988 number. How does that work? Do we, I mean, I know it's brand new, so what?
So we're just learning ourselves about it, so I don't want to speak too authoritatively, but I know that people can now call 988, and depending on what state you're in, will either be routed through the state's suicide hotline that is already existing, or to the federal phone banks, where there are trained clinicians there. So I have not heard which way Massachusetts is going, but I suspect that Massachusetts is routing the calls first to the state and only overflow to the federal phone banks, because there really is pretty good service already in Massachusetts, whereas some states we know just weren't able to keep up with answering the phone. So those are going directly to the federal number. But we'll have more information as it rolls out, but that's about all we know right now.
Okay. All right, yeah, like I said, I know it's brand new, like, what was it, 2 days old? And the other thing you mentioned again was with the stigma. I mean, and I was on one of the task force calls or Zooms that you had, and I don't remember who, maybe it was one of you, but there was mention that maybe something that the city can help with is, you know, kind of, we've got the COVID playbook of getting the word out about vaccines and testing sites. Maybe, again, that's a role that we can help with, of getting the word out about, you know, the new facility opening and things that are available. So maybe we can have some ongoing, you know, partnership and discussion about that. And then the other thing, you know, with the information that was presented, I think my colleague, Councilman Castro, mentioned just having that information and being able to talk to constituents. And when we hold our ward meetings this fall, when we start doing that again, you know, talking about this, maybe that can kind of help get the word out and help with stigma and just bringing it up and bringing up the topic and talking about it, you know. So again, I really thank you guys for being here this evening. And you know, I know that there are a lot of folks in our city that are struggling, and you know, hopefully we can do more to help them.
Well, thank you for inviting us. It's such an important issue that it's nice to hear you all are interested, so thank you.
Yeah, you know, I think we all recognize how important it is, and unfortunately earlier this year, you know, I lost a friend who succumbed to his mental health issues, and so that was a real big, I guess, board upside the head wake up call of just how many people are struggling, and you know, so yeah, it's really tough. So thank you.
Thank you.
Thank you, Counselor. Counselor Rodriguez.
Well, thank you, Mr. Chairman. Ladies, welcome. I have a quick question for you. Apologies, a little, not COVID. You mentioned the ODs, the number of folks that OD in the Brockton area and also in the hospitals around the area. How does the Brockton numbers compare to, let's say, cities of equal size to Brockton? How are we doing compared to some of those other communities?
Brockton's rates are considerably higher by a wide margin than the statewide average. If you just compare Brockton to the subset of, say, gateway cities, we're in the upper third, but not at the top.
So we're up there, basically. Okay. All right. Well, thank you. That was my question. And again, thank you for coming tonight. Thank you, Mr. Chairman.
Thank you, Counselor. Counselors, anything?
Motion to recommend favorably back to the full city council.
Second.
Motion's been properly made and seconded. All those in favor? All those opposed? Motion passes. Thank you guys for coming in. You know, the folks at home, there are people out there, you know, reach out. It's Thank you. Very important. Counselors, that's the end of our agenda. Is there anyone with any moments of personal privilege? Counselor Azak, followed by Counselor Nicastro.
Thank you. CNN. Thank you. I'm proud to be CNN. I would like to let everybody at home know that our Veterans Services Department is looking for veteran stories here in the city of Brockton. They're looking to honor veterans for hometown hero banners, Memorial Day, Purple Heart Day, Veterans Day, monuments, etc. So please contact the Veterans Services to see how you can tell your story or talk about your veteran. I did jot down their phone number, but I know they have their posters around the city at City Hall, but contact Veterans Services at the city of Brockton. We're looking to find our veterans. Thank you.
Thank you, Counselor. Counselor Nicastro.
Thank you. Well, recently, the DPW undertook a mailing to bill owners of, property owners in the city for stormwater fees. And I am underwater with a number of calls I've gotten regarding these stormwater fees, and I know many of my colleagues are as well. So Councilor Lally and I have put our heads together, and we have filed a resolve to bring the head of DPW, the CFO of the city, and the city engineer, and anyone else they may send to speak with us. And the resolve will be introduced at next week's city council meeting. And in the interest of time, since we're on our summer session, I will be making a motion to suspend the rules and hear from these people next Monday night so that our residents can get some important information. And I'm hoping that you'll all work with me so that, and Councilor Lally, so that we can have these people come and speak to us and, you know, get a proper explanation of what these fees are for, and what they cover, and what's being required of the city of Brockton that these fees were imposed. So I just want our residents to be aware of it, as well as all of you, my colleagues. Thank you. Thank you.
Thank you, Counselor. Seeing no other business before us, we are adjourned.